This video of mine is about IBS or Irritable Bowel Syndrome. This is a very important video because this illness is very common, especially among women. Earlier I posted a short overview about this problem. I hope you have seen that short video. And today I am going to post this detailed video about this condition known as Irritable Bowel Syndrome or IBS in short form. This is a common disorder that affects the large intestine. Signs and symptoms include cramping, abdominal pain, bloating, gas, and diarrhea or constipation or both. IBS is a chronic condition that you will need to manage long term. Only a small number of people with IBS have severe signs and symptoms. Some people can control their symptoms by managing diet, lifestyle, and stress. More severe symptoms can be treated with medication and counseling. IBS does not cause changes in bowel tissue or increase your risk of colorectal cancer. Now I will tell you the symptoms of this illness. The signs and symptoms of IBS vary but are usually present for a long time. The most common signs and symptoms include abdominal pain, cramping or bloating that is related to passing a bowel movement, changes in appearance of bowel movement, changes in how often they are having a bowel movement. Other symptoms that are often related include bloating, increased gas, or mucus in the stool. You should see your doctor if you have a persistent change in bowel habits or other signs and symptoms of IBS. They may indicate a more serious condition such as colon cancer. Because this IBS is a condition which is symptoms of which are related to are almost similar to some other illnesses which can be dangerous such as colon cancer. So you should see your doctor if you notice these persistent symptoms, okay? And especially the more dangerous, if you have more dangerous symptoms which I am going to tell you now, you should see your doctor immediately because a colorectal cancer can cause some dangerous symptoms which may resemble some initial symptoms of IBS, okay? So these symptoms are like weight loss, diarrhea at night, rectal bleeding, iron deficiency anemia, unexplained vomiting, difficulty in swallowing, or persistent pain that is not relieved by passing gas or a bowel movement. Because there are so many digestive disorders, so if you have some serious symptom which I've just told you, then you should seek help of the doctor to rule out any other cause of these symptoms, okay? Now I will tell you the causes of IBS. The precise cause of IBS is not known. Factors that appear to play a role include muscle contraction in the intestine. The walls of the intestine are lined with layers of muscle that contract as they move food through your digestive tract. Contractions that are stronger and last longer than normal can cause gas, bloating, and diarrhea. On the other hand, weak intestinal contractions can slow food passage and lead to hard, dry stool. Because in this IBS, you can suffer from diarrhea, or you can also suffer from constipation, or you can suffer from both, okay? So this is a factor in IBS. Another factor is that there are abnormalities in the nerves in your digestive system that may cause you to experience greater than normal discomfort when your abdomen stretches from gas or stool. Poorly coordinated signals between the brain and the intestines can cause your body to overreact to changes that normally occur in the digestive process, resulting in pain, diarrhea, or constipation. Severe infection. IBS can develop after a severe bout of diarrhea, which is gastroenteritis caused by bacteria or a virus. IBS might also be associated with the surplus of bacteria in the intestine, which is known as bacterial overgrowth. Another factor is that if you have suffered from early life stress, people exposed to stressful events, especially in childhood, tend to have more symptoms of IBS. Changes in gut microbes. Examples include changes in bacteria, fungi, and viruses, which normally reside in the intestine and play a key role in the health. Research indicates that the microbes in people with IBS might differ from those in healthy people. Okay, so these were some factors. Okay, as I told you, the exact cause is not known, but these were some factors. Okay, which can play a key role in this problem. Okay, now I should tell you some triggering factors which the symptoms of IBS can be triggered by food. The role of food allergy or intolerance in IBS is not fully understood. A true food allergy rarely causes IBS, but many people have worse IBS symptoms when they eat or drink certain foods or beverages, including wheat, dairy products, citrus fruit, beans, cabbage, milk, and carbonated drinks. Stress. Most people with IBS experience worse or more frequent signs and symptoms during periods of increased stress, but while stress may aggravate symptoms, it does not cause them. Stress does not cause IBS, but if you are suffering from IBS and then stress may, if you suffer from stress, then that the symptoms of IBS can be aggravated. Okay. Now I should tell you the risk factors. Many people have occasional signs and symptoms of IBS, but you are more likely to have the symptom if you are young. IBS occurs more frequently in people under age 50 or female. In USA, in fact in almost every country, IBS is more common among women. Estrogen therapy before or after menopause also is a risk factor for IBS. If you have a family history of IBS, and then there is a risk factor also. Genes may play a role as may shared factors in a family's environment or a combination of genes and environment. If you suffer from anxiety, depression, or other mental health issues, that can be also a risk factor. Especially if you have a history of sexual, physical, or emotional abuse, also might be a risk factor. Okay. Now I should tell you the complications. Chronic constipation or diarrhea can cause hemorrhoids. In addition, IBS is associated with poor quality of life. Many people with moderate to severe IBS report poor quality of life. Research indicates that people with IBS miss 3 times as many days from work as do with those without bowel symptoms. Mood disorder. Experiencing the signs and symptoms of IBS can lead to depression or anxiety. Depression and anxiety also can make IBS worse. Now coming to the diagnosis of irritable bowel syndrome, there is no test to definitely diagnose IBS. Your doctor is likely to start with a complete medical history, physical exam, and test to rule out other conditions such as celiac disease. After other conditions have been ruled out, your doctor is likely to use one of these criteria, which I am going to tell you now. This is a diagnostic criteria for IBS. And the first is that Rome criteria. These criteria include abdominal pain and discomfort lasting on average at least 1 day a week in the last 3 months, associated with at least 2 of these factors, which I am going to tell you now. Pain and discomfort are related to defecation. The frequency of defecation is altered, or stool consistency is altered. If you have these things, pain and discomfort related to defecation, frequency of defecation is altered, stool consistency is altered, then if you suffer from abdominal pain and discomfort at least 1 day in a week for the last 3 months. Okay, so this is a Rome criteria. Okay. Then we also for the purpose of treatment, we divide IBS mainly in 3 types based on your symptom. The first is constipation predominant. As I told you that some patients present with symptoms related to constipation. In addition to abdominal pain and bloating, some patients present with the diarrhea predominant symptoms. So this is a second type of IBS. Or if somebody is presented with mixed symptoms, alternating diarrhea or constipation, then this is a third type of IBS. Okay. We also likely to assess whether you have other signs and symptoms that might suggest another more serious condition. So as I told you, there are some signs and symptoms. If like for example weight loss, rectal bleeding, fever, or recurrent vomiting. If you present with these kind of symptoms, then we may have to rule out some other conditions. For example, some patients present with anemia as well due to this. If for example due to low iron, if there is bleeding from intestine or large intestine, rectal bleeding, then the patient can present with anemia. So we have to rule out all other causes. Okay. Similarly, to rule out other illness, we may order additional tests like colonoscopy, CT scan, X-ray or CT scan, and also because these tests, for example, colonoscopy, we usually use a small flexible tube to examine the entire length of colon. Okay. Also, if we for X-ray or CT scan, these produce images of your abdomen and pelvis that might allow your doctor to rule out other causes of your symptoms, especially if you have abdominal pain. Your doctor might fill your large intestine with a liquid which is known as barium to make any problems more visible on X-ray. The barium test is sometimes called a lower GI series. Okay. Also, we may order upper endoscopy. A long flexible tube is inserted down your throat and into the tube connecting your mouth and stomach. The esophagus connects between mouth and stomach. A camera on the end of the tube allows your doctor to inspect your upper digestive tract and obtain a tissue sample, which is biopsy, from your small intestine and fluid to look for overgrowth of bacteria. Your doctor might recommend endoscopy if celiac disease is suspected. If there is a suspicion of other disease such as celiac disease and like bacterial overgrowth, then we may order this upper endoscopy as well. Okay. Then there are certain laboratory tests which may include lactose intolerance test. Lactase is an enzyme that you need to digest the sugar found in dairy products. If you don't produce lactase, you may have problems similar to those caused by IBS, including abdominal pain, gas, and diarrhea. Your doctor may order a breast test or ask you to remove milk and milk products from your diet for several weeks. Okay, then another test, breast test for bacterial overgrowth. A breast test also can determine if you have bacterial overgrowth in your small intestine. Bacterial overgrowth is more common among people who have had bowel surgery or who have diabetes or some other disease that slows down digestion. We may also order stool tests. Your stool might be examined for bacteria or parasite or a digestive liquid produced in your liver, bile acid. Stool can be examined for bacteria, parasite, or bile acid. Okay. Especially the patient who suffer from chronic diarrhea, so we may order this stool test also. Okay. Now coming to the treatment. Treatment of IBS focuses on relieving symptoms so that you can live as normally as possible. Mild symptoms and signs can often be controlled by managing stress and by making changes in your diet and lifestyle. You should try to avoid food that trigger your symptoms. Eat high fiber foods, drink plenty of fluids, exercise regularly, get enough sleep. Your doctor might suggest that you eliminate from your diet high gas foods. If you experience bloating or gas, you might avoid items such as carbonated and alcoholic beverages and certain foods that may lead to increased gas. Gluten. Research shows that some people with IBS report improvement in diarrhea symptoms if they stop eating gluten, which is found in wheat, barley, and rye, even if they don't have celiac disease. And then there's the abbreviation that is F4D MAPS. Okay. Some people are sensitive to certain carbohydrates such as fructose, fructose, lactose, and others, known as FODMAPs. F4D MAPS. This is like abbreviation for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These FODMAPs are found in certain grains, vegetables, fruits, and dairy products. Okay, so if you avoid this, then symptoms can be improved. A dietitian can help you with these diet changes. If your problems are moderate or severe, your doctor might suggest counseling, especially if you have depression or if stress tends to worsen your symptoms. In addition, based on your symptoms, your doctor might suggest medications such as fiber supplements. Taking a supplement such as psyllium, which comes with the name of metamucil with fluid, may help control constipation. Laxative. If fiber does not help constipation, your doctor may recommend over-the-counter laxatives such as magnesium hydroxide, coming with the name of milk of magnesia, or polyethylene glycol, which comes with the name of Miralax. Okay. Then, if you suffer from diarrhea in IBS, we may prescribe anti-diarrheal medications. Over-the-counter medications such as loperamide, which comes with the name of Imodium, can help control diarrhea. Your doctor might also prescribe bile acid binders such as cholestyramine, which comes with the name of Prevalite. Okay, bile acid binders can cause bloating. This is a side effect of bile acid binders. Then we may also prescribe anticholinergic medications such as Dicyclomine, which comes with the name of Bentyl, can help relieve painful bowel spasms. They are sometimes prescribed for people who have bouts of diarrhea. These medications are generally safe but can cause constipation, dry mouth, and blurred vision. Also, we may prescribe tricyclic antidepressants. This type of medication can help relieve depression as well as inhibit the activity of neurons that control the intestine to help reduce pain. If you have diarrhea and abdominal pain without depression, your doctor may suggest a lower than normal dose of imipramine, which comes with the name of dofranil, okay, or some other antidepressants such as desipramine, okay. Side effects which might be reduced if you take the medication at bedtime can include drowsiness, blurred vision, dizziness, and dry mouth. Then also we may prescribe SSRI antidepressants, selective serotonin reuptake inhibitors, antidepressants such as fluoxetine, which comes with the name of Prozac, or paroxetine, which comes with the name of Paxil, may help if you are depressed and have pain and constipation. Also, we may prescribe additional some pain medications such as pregabalin, which comes with the name of Lyrica, or gabapentin, which comes with the name of Neurontin. These might ease severe pain or bloating. Okay. Now, this was actually a general treatment about IBS. Now, I will tell you some specific medicine which are given given in the case of irritable bowel syndrome. Okay, these medicines are specific to this illness. The first medicine is known as allocetrone, which comes with the name of Lotronex. Allocetrone is designed to relax the colon and slow the movement of waste through the lower bowel. Allocetrone can be prescribed only by doctor enrolled in a special program. It is intended for severe cases of diarrhea predominant IBS in women who have not responded to other treatments, and is not approved for use by men. It has been linked to rare but important side effects, so it should only be considered when other treatments are not successful. Then there is another medicine that comes with the name which is known as Iloxadoline, which comes with the name of Vyberzi. And this medicine, Iloxadoline, can ease diarrhea by reducing muscle contraction and fluid secretion in the intestine and increase muscle tone in the rectum. Side effects can include nausea, abdominal pain, and mild constipation. Iloxadoline has also been associated with pancreatitis, which can be serious and more common in certain individuals. Then there is another medicine, that is rifaximin, which comes with the name of Zifazan. This is an antibiotic that can decrease bacterial overgrowth and diarrhea. Okay. Then there is another medicine which is known as lubiprostone, which comes with the name of Amitiza. This can increase fluid secretion in your small intestine to help with the passage of stool. It is approved for women who have IBS with constipation, and is generally prescribed only for women with severe symptoms that have not responded to other treatments. Then there is another medicine which is known as linaclotide, which comes with the name of Linzess. Linaclotide can increase fluid secretion in your small intestine to help you pass stool. Linaclotide can cause diarrhea, but taking the medication 30 to 60 minutes before eating might help. Now, there are some potential future treatment which I should tell you. Researchers are investigating new treatment for IBS, such as fecal microbiota transplantation, that is FMT in short form. This treatment is considered investigational at this time. FMT restores healthy intestinal bacteria by placing another person's processed stools into the colon of a person affected by IBS. Clinical trials to study fecal transplants are currently underway. Now I should tell you some lifestyle and home remedies about IBS. Simple changes in your diet and lifestyle often provide relief from IBS. Your body will need time to respond to these changes. You can try to experiment with fiber. Fiber helps reduce constipation but also can worsen gas and cramping. Try slowly increasing the amount of fiber in your diet over a period of weeks with foods such as whole grains, fruits, vegetables, and beans. A fiber supplement might cause less gas and bloating than fiber-rich foods. Avoid problem foods. Eliminate foods that trigger your symptoms. Eat at regular times. Do not skip meals and try to eat at about the same time each day to help regulate bowel function. If you have diarrhea, you may find that eating small frequent meals makes you feel better. But if you are constipated, eating large amounts of high fiber foods may help move food through your intestines. Exercise regularly. Exercise helps relieve depression and stress. stimulates normal contraction of your intestine and can help you feel better about yourself. You should ask your doctor about an exercise program. Now, I should tell you there is some role of alternative medicine in IBS. This is the role of alternative therapies in relieving IBS symptoms is unclear. You should ask your doctor before starting the treatment, which I should tell you. These alternative therapies include hypnosis. A trained professional teaches you how to enter a relaxed state and then guides you in relaxing your abdominal muscles. Hypnosis may reduce abdominal pain and bloating. Several studies support the long-term effectiveness of hypnosis for IBS. Another option is peppermint. Studies show that in people who have IBS with diarrhea, especially coated tablet that slowly releases peppermint oil in the small intestine, that is enteric coated peppermint oil, eases bloating, urgency, abdominal pain and pain while passing stools. Probiotics. Probiotics are good bacteria that normally live in your intestines and are found in certain foods such as yogurt and in dietary supplements. Recent studies suggest that certain probiotics may relieve IBS symptoms such as abdominal pain, bloating, and diarrhea. Stress reduction. Yoga or meditation can help relieve stress. You can take classes or practice at home using books or videos. So this was my video about IBS. I hope you like this video. If you have any question about this illness, or if you are suffering from this illness or any other illness, you can post comments in the comment section of this video, and I'll try to make a video about your illness if possible. If I don't find a time, then I'll try to reply to your comment as soon as possible, because I reply to almost every comment on my channel. Okay, and if you think if you till now if you haven't subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my videos provide some sort of benefit, even if it is little benefit, please do not forget to give a thumbs up to this video, and also do not forget to share my videos to others through social media such as Facebook and Twitter.